Hi, welcome to 1+1 is 3. I'm Kirsten and today I'm going to be doing my 36-week pregnancy update and talking a little bit about home birth. If you're new here, welcome. I am currently pregnant with my third child and I had my 36-week checkup with the midwife last week, and she actually came to my house for that to do a home birth preparation as well. So let's start with the normal checkup things. My urine test was fine, my blood pressure was fine. The midwife palpated my bump and said that the baby was head down, which is great. At the time, he was 3/5 engaged. If you look it up, there's a little scale from 1 to 5 of how engaged the baby is, and he was on 3, which means the head was engaged in my pelvis at that time. I think he's been kind of coming out and popping down into my pelvis again, but I'll chat a little bit more about that when I talk about symptoms. We discussed the birth and the different options that I had around that. I've chosen to give the baby vitamin K orally. I did that with my last baby as well, just because I'm trying to have a really calm, peaceful birth for me and for the baby, and I just think as soon as it's born, just jabbing it straight away with a needle is not very gentle, basically. And if there's no reason that he actually needs the vitamin K urgently, then I'm happy to give it orally. I think they give 1 dose after the birth, and then I think a few days later they have to have another one, and then possibly a third one as well. But the midwife comes around, the community midwife comes around to your house and gives that anyway, so it's not something that you have to remember. I would prefer to do it that way, so long as there's no medical reason that the baby desperately needs vitamin K straight away. That's all to do with bleeding. I urge you to have a little look up on the internet and read a little bit about it. It's one of those things that's just done as standard, and I think women don't really know that they've got an option around that. So yeah, I would encourage you, if you're having a baby, just to do a little research into that. You might be fine with giving them injections straight away, and that's absolutely up to you. The next thing that we discussed was that I would like a physiological rather than a managed third stage. And the third stage is the bit from when the baby is out until the placenta is out. Basically what that means is I'm not going to have an injection either to make that speed up. We're just going to let it happen naturally, and skin to skin and breastfeeding immediately can help with that. Obviously, again, unless there's a medical need for it, if for some reason they need to get that placenta out of me quickly, then absolutely fine, give me the injection. But if there's no reason to, then I'm happy just to kind of wait and let it happen naturally. And also, along with that, I am opting for delayed cord clamping. So the baby's umbilical cord will not be clamped until it has stopped pulsating, which means that all the blood has gone from the placenta into the baby, because that's all blood that belongs to the baby and is going to help it be healthy and fit and strong. So I want it all to have gone into the baby before the cord is clamped and cut. So that's called delayed cord clamping, and I would really urge you to research that as well, because there's been quite a lot of research into the benefits for the baby of delayed cord clamping. And again, it's one of those things that if you're in hospital and you haven't stated your preference, it will probably just be done automatically a minute or so after you've delivered the placenta, and the blood won't have all crossed the cord to the baby. And yeah, a lot of people don't know that you have an option around that, and that you can actually ask for delayed clamping. So those are all options that my midwife has recorded in my notes, and whoever the midwife or midwives are that come to help deliver the baby, they will have a record of that, and they will know that all that is going to happen, and those are my preferences, so I won't have to worry about it at the time. So next, on to the home birth bit. I wanted a home birth with my last child, but unfortunately I wasn't able to because I had a higher BMI than I do now, and that put me at high risk, and you're only able to have a home birth if you are a low risk mother. But I've lost a bit of weight since my last baby, and that thankfully puts me in the low risk category, so they're happy for me to be allowed to have a home birth, which is great. And the midwife filled in this home birth assessment questionnaire, so I'm just going to use it to remind me what we discussed. So we discussed how to contact the midwife when I do go into labour, and how it works where I live is I have to call the delivery suite and they actually get in touch with the community midwives and send them to my house. We talked about monitoring. The community midwives where I live don't have proper monitors, they only have Dopplers, but they're quite used to using those and it's quite safe. We talked about pain relief. The midwives carry Entonox or gas and air, so if I need that then that's fine, but if there's any further drugs that I decide I would like, then that would mean I would have to go to hospital. But hopefully I won't be needing any of those because I will be using hypnobirthing. If you'd like to see more about that, then check out my last video. We talked about what would happen if there was an emergency or something unexpected happened during my labour and birth, and I'm really lucky that I'm only 5 to 10 minutes ambulance drive away from the hospital where I live, so I'm not too worried about that. When you are full term, so 37 weeks pregnant and onwards, and you're planning a home birth, they actually notify the ambulance station so that they're on standby, knowing that at any point you could go into labour at home and they might be needed. Also, I think on the day when the midwife actually comes to my house, she will notify them that I am in labour, so they're always on standby and kind of ready to come, and they know where my house is should they be needed, so that's great to know. Next, we talked about practical things like heating and hot water. I am borrowing the birth pool from my local community midwives, and so we are going to need to have plenty of hot water on tap. So our plan basically is to, as soon as I go into labour, we will just put the heating on permanently so that the house is nice and warm for the baby once he's born, and there's plenty of hot water to fill up the pool. We also needed to buy a few little bits for the birthing pool ourselves. I think a liner is provided, but we had to buy the special hose that goes from the tap to the pool, and then the connectors to connect the hose to the tap, and something else that we had to get was some plastic dust sheets just to put down under the pool and on the carpet and on the sofa and things like that, anywhere that I might want to be giving birth, just to protect them, keep them clean, all that kind of stuff. And we also talked about where my other 2 children were going to go, and the dog as well, when I'm actually in labour. And I've decided not to have them around at the time just because I'm trying to hypnobirth, so I want everything to be calm and quiet, and I don't want to have to worry about anything. And I know that if the kids are here, I'll be worrying about whether I'm being too noisy and I'm going to wake them up if they're asleep. I'll be worrying about how they're feeling, whether they're afraid, whether I should let them see the birth and things like that. And I just want to know that they're at my mum and dad's house, safe and sound, being looked after. I don't have to worry about them or think about them at all during that time. But the biggest advantage of having a home birth is that once the baby is born and everything's cleared up, they can come back home and we can just be a little family. But the advantage of a home birth is that once the baby is born and everything's been cleaned up, they can come back home and we can be a little family and they can meet their new baby brother. So that's the practicalities of the home birth. I just wanted to talk a little bit about the kind of pros and cons and why I've decided to have one. The main reason is that I'm going to be hypnobirthing, and the whole premise of hypnobirthing is being calm, being relaxed, and I just think, where can you be more relaxed than in your own home? And as well as that, the community midwives where I live are really trained up on home birth. They see it almost all the time. The majority of the home births that they attend are hypnobirths. So they understand everything about hypnobirthing, which I think the midwives in the hospital do a little bit less. And there's lots of other little reasons, like the bugs that you can get in hospitals, sharing wards with lots of other mothers and crying babies, and the fact that I'll be able to sleep in my own bed that night in comfort and have whatever food and drink I want afterwards, rather than just the standard tea and toast that's offered to you in hospital. And because I'm so close to the hospital, I think a big thing that would turn other people off is what if there's an emergency and you need to be in hospital. For me, that's really not an issue because I would be there so quickly. So symptoms wise, I think there's been a couple of occasions where the baby has actually engaged into my pelvis and then later come back out again, because when that happens, I feel just this immense pressure on my pelvis, and it almost feels as though my pelvic bones are going to crack. It hurts that much, and I feel like I have to walk with my legs wide open. So it's really painful and a little bit embarrassing as well, because I am more than waddling. But thankfully the baby has then come back out of my pelvis and relieved all that pressure and pain. So I haven't been like that permanently. It's just been the odd day where it's happened. I've also started to get a bit of heartburn again. It happens most often when I'm lying down in bed, about to go to sleep. I'm waking up pretty much at the same time every night now, needing to go to the toilet. I'm starting to feel really tired by kind of mid-afternoon now. I am exhausted and it's kind of making me feel quite grumpy and fed up with being pregnant. So I'm trying to tell myself that I could have another kind of 5 or 6 weeks to go. I've been nesting a little bit, trying to keep things all clean and tidy and make sure everything is ready for the baby. I've washed all the baby clothes. But yeah, I'm just looking forward to finishing work now and it being half term, so I can really slow down, take a little bit of a break, try and get some rest. I really need to practice my hypnobirthing more, do some more of the breathing techniques and the relaxation so that I'm prepared for the birth. So although I'm planning a home birth, I do still need to be prepared for the unexpected, and I have packed a hospital bag. So if you'd like to see what's in that, then do click subscribe and also click on the notification bell, because I will be uploading a what's in my hospital bag video next week. I hope you've enjoyed this update. If you did, then do click the thumbs up, and if you have any questions about home birth, do leave them in the comments and I will do my best to answer them. Thank you so much for watching. Bye.